It was gross because I felt like he was still on me.
This 28-year-old woman says she's just starting to get over what happened to her more than a year ago. New Year's Eve 2014 in Pictou, she says she was raped in her own home by her neighbor. First, she went to the Tatamagouche hospital. A doctor there told her he couldn't handle her case and that she needed to go back an hour in the other direction to New Glasgow. But staff there told her they couldn't deal with her that day either. So she went home. She ended up waiting 3 days to have a rape kit done.
I couldn't shower. I had to take my clothes that I wore that night and put them in a plastic bag so that the evidence wouldn't be tampered with.
Nova Scotia only has sexual assault nurse examiners in 2 regions of the province, Halifax and Dantigonish. In this case, a team had to make a 40-minute trip to New Glasgow to help the woman. Most areas of the province are supposed to rely on emergency room staff to do the sexual assault test.
Physicians and ER nurses don't have forensic training typically unless they've received that elsewhere, but largely not. And yet they're expected to be the experts in these situations.
Susan Wilson says she often hears from ER doctors who aren't comfortable doing the test or say they simply don't have the 6 hours it can take. The same concerns are heard at the Colchester Sexual Assault Centre.
To me, if somebody is wanting a rape kit done, they should be able to access that at any hospital, period.
If I was able to walk into the hospital and just be able to talk to somebody and then have them right there, that would have been so much better than me actually sitting in that filth for 3 days.
The Nova Scotia Department of Health says it's now looking at launching 2 more sexual assault nurse examiner programs in the province. But the minister acknowledges it still wouldn't cover every corner of the province, and it could take another 2 years to implement. Angela McIver, CBC News, Halifax.